Hi, everyone. My name is Devin Estes, and I'm one of the new senior trainers for MRAP this coming year. And today I'm making a video about Coup, aka ED complex opioid using patients. This is one of our newer studies, so I wanted to provide a bit more information and describe the screening process so that it's a bit easier for you all to learn the new material and everything. So the two primary investigators of this study are Dr. Stephen Henry and Dr. Amy Moulin. This is one of our newer studies. It just started in January, and we actually have no anticipated completion date yet, still TBD. So before I get started, if anyone ends up having any questions at the end of this, please feel free to reach out to either of the senior trainers or the head trainer with any questions that you might have. So to get started, I'm going to be talking about some of the conditions that we kind of focus on in this study. And one of those is opioid use disorder. I'll be referring to it as OUD. And OUD is essentially just a physical or psychological reliance on opioids. And opioids are substances that are found in certain prescription pain medications and street drugs like heroin. They're usually prescribed in the clinical setting for pain relief, but they can actually become less effective over time with prolonged use. And this prolonged use essentially requires greater quantities in patients to actually feel a difference in their pain relief. So this dependence actually causes some severe withdrawal symptoms if they ever want to quit opioids cold turkey. And lastly, four primary opioids that you might see that are used for acute pain treatment in the ED are morphine, meperidine, fentanyl, and hydromorphone. So you might be seeing those in some of your MARs as you're screening for some other studies. So just keep an eye out for those. So the next group of patients that we focus on in this study are those with chronic pain, and specifically those who use opioids to cope with chronic pain. And essentially, chronic pain is just long-standing pain that might persist beyond a usual recovery period or occur along with a chronic health condition. Arthritis is a perfect example. It causes intense pain in the joints. And this may be caused by inflammation or nerve damage, and it may last weeks to years or an entire lifetime, unfortunately, in some of our patients. So in ED Coup, we're actually really just focusing on two types of patients with chronic pain, and it's going to be those with musculoskeletal pain or headaches. So that's definitely something that we really keep in the front of our minds when we're screening for this study. So my last bit of background information, I wanted to talk a bit about buprenorphine. And buprenorphine is actually an opioid itself, and it's used to treat opioid use disorder. And it's used in this way through a medication-assisted treatment plan, aka a MAT plan. And MAT plans are actually super interesting. So essentially, once the body has formed a dependence on opioids after a period of sustained use or misuse, taking the opioids away completely can actually result in some really severe withdrawal symptoms that are super debilitating for the patient. So this can be anxiety, agitation, muscle aches, cramping, insomnia, yawning, sweating. So it's really unpleasant. And essentially, a MAT plan prevents participants from experiencing these withdrawal symptoms or severe cravings, which allows them to focus on their recovery. So doctors will prescribe buprenorphine as a part of this MAT plan, and many patients will actually decide to stay on this medication indefinitely because it can prevent compulsive seeking of other more dangerous opiate alternatives like street drugs. So now a bit of background about this study specifically. So often when patients come into the ED, they're not coming in with one thing. They're going to have multiple medical and behavioral comorbidities, but most studies actually just tend to focus on one condition at a time. And this isn't always the best treatment plan. So Davis is actually a leader in a national movement to identify and offer treatment to these complex patients with problems that specifically involve opioids and connect them to outpatient treatment like the California Bridge program. And the California Bridge program essentially is championing the idea that substance use disorder is a condition that should be treated by medical professionals like any other life-threatening condition. Unfortunately, most medical providers don't view addiction treatment as part of their job. So people who use drugs are often stigmatized. They're sometimes treated for other conditions, but then they'll be sent on their way with a list of actually inaccessible specialty addiction clinics. So the CA Bridge program's goal is to transform addiction treatment by ensuring that every hospital in the state can provide 24/7 access to evidence-based care as a part of a coordinated care approach. So it's a really interesting program, and if you guys have any interest at all in learning more about it, they have a really great informational website that I actually have linked at the end of the presentation. So as for the specific purpose of this study, the goal is to recruit a group of English or Spanish-speaking participants from the ED who either have OUD and are started on buprenorphine as a treatment or who are taking opioids for chronic pain management. And they want to follow participants for several months to collect data about their treatment needs. And then these results are going to be used to improve patient treatment and design larger studies to improve the care of patients with opioid-related problems with that coordinated care approach that I discussed earlier. So now I'm going to get into the actually very lengthy inclusion and exclusion criteria. This is kind of confusing. It was confusing to me at first. So again, if you have any questions, please feel free to reach out. And all of this screening information is of course on the Canvas file for ED-Coup. What you're looking at right now is essentially just translated straight from the screener sheet for this study. And this is what you're going to be using to check out those inclusion and exclusion criteria when you're screening. So the first section that we're going to look at is essentially just the general exclusion criteria. So we cannot enroll minors, prisoners, or anyone who speaks a language other than English or Spanish. So if you see any of those categories in your patients, then you're immediately going to exclude them. But if none of that applies to the patient that you might be looking at, you're going to continue on to section 2. And this is where we actually start sorting patients into 2 cohorts. We have an opioid use disorder cohort and a chronic pain cohort. So section 2, essentially the 2 main questions that we're asking is if the patient has been referred to a substance use navigator, aka a SUN team, or if they've been prescribed buprenorphine during this visit, or both. So if the answer is yes to either of these questions, they're going to be eligible as an OUD patient cohort, and you can actually skip to section 4, and I'll discuss that a little bit later. If the answer is no to both, we're going to continue on. But before I move on, I just wanted to say that SUN referrals are typically in the doc plan tab on the trackboard. So you don't actually need to click into the patient's chart for this. This is usually in that doc plan column right on the trackboard. So you should see this right away. So if we say no to both of these questions, we're going to move on to section 3, which is about our chronic pain cohort. So the first thing we're going to be looking at is if the patient is being admitted to the hospital, and we completely exclude anyone who's being admitted to the hospital. We want these patients to stay in the ED at least for a little while. And hospital admission plans can be determined from the color of the patient's row in the legend. And I think this color should be on or near the patient's bed number. And there should be a key or a legend on the trackboard that you can use. So there will be different colors, for if the patient is being discharged, if they're being moved to an ED bed, if they're being admitted, or this is also sometimes in the communications column on the trackboard. So if they're not being admitted to the hospital, we're going to continue on to section 3B, and we're going to see if the patient is coming in with a chief complaint related to pain. This is one of the first things I personally look for in this study because it's so easy to see on the trackboard. So if the answer is no, we're just going to exclude them from this cohort. They, of course, could be eligible for the OUD cohort if you establish that in section 2. And then if the answer is yes, if they are coming in with pain, we completely exclude any patient that comes in as a coded trauma or if they have abdominal, chest, or sickle cell related pain. And for sickle cell, this will typically be listed as a sickle cell crisis or a sickle cell pain crisis. So we can exclude these patients. We are just referring to those musculoskeletal or headache patients. And then if they are experiencing musculoskeletal or head pain, we're going to continue on to 3C, which is where we actually look at their home medication list. And we're going to be checking to see if they have either any opioid medication on that list, including outside sources, or naloxone, aka Narcan, on their home medication list. Naloxone is a medication that's used in narcotic overdoses. It's an opioid antagonist, meaning it attaches to opioid receptors and reverses or blocks the effects of other opioids. It rapidly restores normal breathing patterns in patients that are overdosing on narcotics, but it actually has no effect on anyone who doesn't have any opioids in their system, and it is definitely not a treatment for OUD. So that's just some interesting information if you guys want to keep that in mind. So the way we check the patient's home medications list, this is going to be in their chart, and it should be found under medications from an outside source in EMR or the summary section. And when we're seeing what medications are on their home medication list, we want to refer to the list of opioids, example opioids, on page 2 of the screener document in Canvas. And again, this is going to be in the files for ED-Coup on Canvas in the study information section. So if we have yes to either or both of these questions, we're immediately going to skip to section 4 and classify them as a chronic pain patient. But if the answer is no to both, we're going to continue to part D. And essentially part D is just going to be usually the RC approaching the patient's physician and asking them different questions to establish what group they may or may not belong to. So at first, they're going to ask if they are presenting with an exacerbation of chronic pain. If the answer is yes, we're going to continue. If the answer is no, we're just going to immediately exclude them. They're also going to ask if they think the patient has a potential OUD. If yes, we're going to continue. If no, we're going to skip to section 4 and classify as a chronic pain patient. And then the last question, are you considering a CA Bridge Sun referral for this patient? If the physician says yes, we're going to classify them as an OUD patient. If the answer is no, they're going to be classified as a chronic pain patient. I'm sorry if I went through that a little bit quickly. I, of course, don't want to keep this video too long. So again, if you have any questions, please feel free to reach out. And as you can see, section 4 is just indicating which cohort the patient belongs to. So lastly, to finish up this very long video, I'm going to be talking about our RA responsibilities. So because this is an RC study, meaning that we cannot personally consent and enroll patients, we're just going to be assisting with the screening process. So I wanted to give you guys some tips for what to look for on the track board and in the patient's chart. So the first thing I always look at is the chief complaint, of course. So some possible chief complaints that you can look for this study are going to be the musculoskeletal pain, headache, and I've actually seen withdrawal a couple times, so that might be something to look into, but it's not very common, so you might not see that. Then we're also going to check the doc plan tab, and this is where we're going to look for a Sun referral. And sometimes they might actually have a note that they want to prescribe buprenorphine. So that's how you can maybe get that, but this is more likely in the medication administration record. So I'll talk about that in a little bit. So as for screening in the patient's chart, once you click in, if you want to check out the patient's home medications list, you're going to go to the summary page, and that list should be right there. And you are going to look for any opioids listed on the screener document in Canvas or naloxone. This might also be referred to as Narcan. As for demographics, this is going to be where we figure out what language the patient speaks. So again, you're going to click into demographics, and if they speak any language other than English or Spanish, we immediately exclude them. And then lastly, we're going to check the MAR, medication administration record, to see if they've been prescribed buprenorphine during their current visit. And then, of course, lastly, don't forget to let the RC or JS know of your potential patient, because they're going to be so helpful in answering any questions that you might have and assisting with the screening process. And of course, approaching the physician, maybe taking you with them to approach the patient's physician, and really just determining what cohort this patient may or may not belong to. Okay, so that should be about everything. I've included some sources that I used, and of course, if you have any more interest in the CA Bridge program, I'm actually realizing now I don't have the link to it, but you can just search up CA Bridge program and it'll pop right up as the first result. I hope you guys found this informational, and if you have any questions, please feel free to reach out. I apologize if I went through things a little bit too quickly. I'm trying to keep this not too long. But thank you so much for watching, and don't hesitate to reach out with any questions.